Good afternoon, and thanks for joining us for Living Local, your lifestyle show for everything Charleston and beyond. I'm Ashley Meservey. It's Medical Monday at East Cooper Medical Center, and today we're talking about a cutting-edge procedure for the arthritic portion of knee replacement surgery.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, Dr. Brodie McKoy. Thanks for having us today.
Well, thank you so much for allowing me to be with you.
All right, we're going to talk about robotic arm-assisted surgery. First off, let's talk about what that is.
Okay, so robotic arm-assisted surgery is where we use a robot to assist in doing the knee replacement. So the brand that we use is something called Mako plasty, which is a type of robotic arm replacement. So we started doing partial knee replacements about 8 years ago in the state of South Carolina and converted over to doing total knee replacements this past year. The way it works, what we do is we get a CT scan or a CAT scan that a lot of people have had those before. We get a CAT scan of the patient's knee. And from that CAT scan, we're able to make a three-dimensional model of the knee such that we can do the surgery on the computer before we ever do it on the patient.
Oh, wow. So what is that, how is that changing the way you do it now?
So it changes a lot as far as precision is concerned. So standardly when we do a knee replacement, it's done just by jigs that are put on the bone to allow us to make the cuts, which is, it works very well in the majority of cases, but not 100%. So a much more precise way to do a knee replacement would be to get a CAT scan beforehand, make a three-dimensional model, and I can take that three-dimensional model and I can rotate it on the computer screen. And I do the surgery on the computer before I ever touch the patient in the operating room.
So you think maybe for the athletes out there and things like that, the more complicated cases, you're actually able to have a better game plan, really?
Yeah, sure. I think a better game plan and probably carrying out the game plan better is a better way to look at this thing. So, when I do the surgery on the computer, if I need to shift the implant, say 1 millimeter or 2 millimeters, just show you on this little model right here. If on the CT scan, I could rotate that thing in 360 degrees, I can see exactly what the fit's going to be like on the back of the thigh as well as on the front of the thigh. So if I need to shift the implant 1 millimeter this way or 1 millimeter this way, or if I need to extend it, flex it up 1 degree or go back 1 degree, I can do that, and then I can take it through a range of motion on the computer until I get a perfect fit. Wow. So what I tell patients is kind of like, the precision is unparalleled. So if you wear a size 7 shoe and I gave you a size 6.5 shoe, you probably wouldn't be happy for a real long time. You want a 7. Well, what this robotic surgery, the precision is so great that it allows us to get within millimeters of what you need to have on your knee. So the game plan is able to be carried out with utmost precision.
That's incredible. Yeah. I'm sure a lot of people at home who've gone through it, especially years and years ago, were like, I wish I had that when I had to go through it.
Exactly right. So if you look at the results of knee replacements, so they do very well overall, but still, even if you look at the big studies, only about 80% of people have an excellent outcome. There's still about 15 to 20% of people who don't have like a great knee. If you talk to enough people who've had knee replacements, you'll find somebody that's not extremely happy with the knee. So even in the best surgeon's hands, you can't get as precise as you'd like to get it. So what we're shooting for with the robotic arm procedure is not an 80% score, but 100.
Oh, I love that.
Your mama's gonna be a lot happier if you got 100 on your test versus 80 on your test.
Well, my parents just wanted anything I could get. So real quick, who's a candidate for this?
So, for the partial knee replacements, there are people that have disease that's isolated to one compartment or one area of the knee. The knee is composed of 3 compartments. So we've got what's called a medial compartment on the inside, a lateral compartment on the outside, and then one underneath the patella or the kneecap. If you've got disease localized to one compartment, then we can do a partial knee replacement, where instead of doing the entire knee, I'm able to do, like this model shows right here, just a knee replacement on just the damaged side. We can do that without cutting any ligaments or any tendons. It's done as an outpatient procedure, go home the same day, and you leave, the things that are not damaged, you don't mess with them. So if not broken, you don't fix it. So that's a very, very successful surgery. If somebody has disease that's kind of more global in the knee and all areas of the knee, then they would need to have a complete knee replacement. When I started out, I was doing probably 50% robotic. I'm doing 100% robotic.
Wow, that's incredible. All right, well, thank you so much for all that fantastic information. And of course, you can always go online for more at eastcoopermedctr.com.